Basic life support, in general, involves a systematic approach to initial patient assessment, activation of emergency medical services, and initiation of cardiopulmonary resuscitation, or CPR, including defibrillation. First step in providing basic life support is verify scene safety. Look around and make sure you and the child are in a safe place. If you are in a safe area, do not try to move the child as he or she may have other injuries that you cannot see, for example removing the victim from a burning building or safely retrieving a drowning victim. Second, determine unresponsiveness, get help, and activate emergency medical services. If victim is unresponsive, single rescuer should shout for nearby help and activate emergency medical response system. For 2 or more rescuers, one rescuer continues care for the victim while a second rescuer activates EMS and retrieves automated external defibrillator. Thirdly, assess breathing and pulse. Rescuer should determine if the victim is breathing or only gasping while simultaneously checking for a brachial pulse in infant or carotid pulse in child within 10 seconds. For an infant, it is easiest to check for a pulse using the brachial artery. To locate the brachial artery, place 2 or 3 fingers on the inside of the upper arm, between the shoulder and elbow. Press the fingers gently for 5 to 10 seconds to feel for a pulse. Pushing too firmly may occlude the infant's pulse. Fourth, initiate cardiopulmonary resuscitation if necessary, with proper method. If you are alone and come across a child who is down, which is not a witnessed sudden collapse, then, as a rescuer, start cardiopulmonary resuscitation. Provide 30 chest compressions, followed by 2 breaths. Then, after about 2 minutes, if still alone, activate emergency response system and retrieve automated external defibrillator if not done yet. But, if you are alone and witnessed a sudden collapse, as a rescuer, activate emergency medical services and retrieve AED, then use the AED. If there are 2 rescuers available, rescuer 1 should assess the child and provide CPR if necessary, while rescuer 2 activate EMS and bring the AED. For CPR, use 15:2 ratio, compressions to breaths. Remember to use 2 thumb encircling technique for compression for infant less than 1 year old, while for child 1 year to puberty, place the heel of one hand over the lower half of the sternum. In larger children, use both hands with the fingers interlocked. If no normal breathing but pulse is present in infant, provide rescue breathing, that is, 1 breath every 3 to 5 seconds, or about 12 to 20 breaths per minute. Add compressions if pulse remains 60 per minute with signs of poor perfusion. Activate emergency response system after 2 minutes. Continue rescue breathing. Check pulse for every 2 minutes. If no pulse, begin CPR. Follow these measures for high quality CPR. First, ensure chest compressions of adequate rate, which is approximately 100 to 120 per minute. Second, every chest compression should be with adequate depth. That is at least 1/3 of its anterior-posterior diameter. Third, allow full chest recoil between each compressions. Fourth, minimize the interruptions in chest compressions. And, lastly, avoid excessive ventilation.
Infant cardiopulmonary resuscitation is resuscitation for the child of less than 1 year old. If you see a baby who is not responding, not moving, not crying, or turning blue, Step number 1. Check for the response by tapping over the sole of the foot. If the baby no responding, no crying at all, step number 2. Ask anyone to activate the emergency response system. Step number 3. Put your hand over the side of the forearm, brachial pulse, and look for the breathing for 5 seconds, not more than 10 seconds. 1, 2, 3, 4, 5. If the baby no pulse, no breathing, step number 4, start the CPR straight away. You are doing a compression at least 1/3 of the anteroposterior chest diameter. We put your 2 fingers right perpendicular over the sternal bone below the nipple line area. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Step number 5, airway and breathing. For the airway, head tilt chin lift in the neutral position. For the breathing, to rescue breathing, your mouth have to cover the baby nose and mouth. Continue the compression immediately after your ventilation. 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In case of 2 rescuer CPR for the infant, 1 rescuer will do the 15 compression followed by 2 ventilation by another rescuer. The compression person will use the hand cycling technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5.